time when we associated hip replacement surgery with our grandparents, but things have changed and now younger people are having it done, and they include people like Lady Gaga, Mary Lou Retton, and even more younger women. We are joined by world-renowned orthopedic surgeon Dr. Richard Berger with Rush University Medical Center and Midwest Orthopedics, and Kia Hinz, one of his patients. Welcome to both of you. Nice to have you here. Dr. Berger, great to see you again. Okay, so let's talk about this. Why are we seeing younger women having this procedure done?
People want to be active. People don't want to have their limitations, don't want to have the world closing in around them. They're also no longer willing to take medications for long periods of time or be on a walker or be on crutches. So they want to get back and enjoy their life. Lots of people have dysplasia, meaning the hips weren't formed normally since birth, and they're predisposed to getting arthritis much earlier.
Okay, so at what point do you decide it's time to do this? Because that could be a tricky question, right?
It's a hard question. It's a very hard question to answer. Most of my patients ask that, and I tell them when they stop running their life and their hip or their knee arthritis starts dictating their life, that's a good time to get surgery.
Okay, now you had it done 12 weeks ago.
I did.
Okay, so tell me what led to having this decision to do this?
So I'm a longtime runner. I've been running my whole life and have never had any issues really up until I would say three years ago. I started noticing some discomfort and some pain around the hip area. I didn't really pay any attention to it. You know, you think it might be the running shoes you're wearing, so you get new running shoes. I remember seeing a chiropractor, maybe thinking it was the back that was issue. And so I just kind of kept going, and I started taking some ibuprofen and getting through my workouts and my runs.
Until you just couldn't do it anymore.
Until I came to the point where it started hurting just walking at all times. And that's when I knew I needed to see a specialist.
And that's when you guys came together. And so tell us about the procedure, because you pioneered the technique that is being used more and more. Explain to people what that is and how far we have come now when we think about hip replacement.
Sure, the old way was to cut all the muscles, ligaments, and tendons, forcibly dislocate the hip, replace it, and then sew everything back together.
So simple, huh?
Right. It's just a very hard, long
very
recovery.
Complicated.
And it doesn't heal completely. This new way that I invented, this anterior muscle sparing approach, does it without cutting the muscles, ligaments, and tendons at all. We make a small incision, go around the muscles, take out the bad hip, kind of like building a ship in the bottle, and put the pieces in. My patients get back to everything very quickly. She was out of the hospital a couple hours later walking with nothing.
Which is amazing.
And back to working in a week or two, back to driving in a week or two, and back to their life very quickly.
Now, were you concerned, because a lot of people always say, you know, this, I just want to stick with the old-fashioned way because it's guaranteed. What was your success rate? What has it been with this? And were you ever concerned that you hear sometimes people only do like a partial and they end up always going back and having to do the whole thing over again? So tell me about that.
Sure, all of those things. You know, it's hard to learn something new. It's hard to change. I think people are changing. It's still hard to find someone who's doing this kind of surgery. I've taught a lot of people, but it's really sweeping because people are just getting better more quickly and more completely. We've now actually done our 10,000th outpatient joint replacement at Rush. So we've been able to help a lot of people get back to their lives.
So 12 weeks out, tell everybody how you're doing and how your recovery was.
Oh, I'm doing great. It's amazing to go from being in constant pain, it's literally pain 24/7, to now being able to walk. I can do everything I did before.
Are you back to running?
I'm walking really fast.
Walking fast.
I'm still in recovery, so I still have a little bit to go, but I'm walking, I'm doing the gym, I'm swimming, I can go biking, I can do everything that I did before.
So you got your life back.
I did.
And I have to ask you one final question, Dr. Berger. Is there a particular candidate that is best for this?
You know, anyone who needs a hip replacement is best for this. Anyone who doesn't want a lot of pain, who wants a quick recovery, who wants to get back to running, get back to their life, is a candidate for this. That's why I see so many people from around the world that come to see us, is because they want a quick, complete recovery.
Right, wow. Well, for anybody who's at home, maybe in pain, thinking about whether or not to do this, what's your advice? At what point should they come see you?
I would tell everyone to just do it earlier, see someone earlier, because you don't want your life slipping away from you. Most of my patients come back and say, thank you for giving me my life back, because arthritis takes away their joy and their happiness.
Yeah, so if you wait too long, you could face other complications. And you're a perfect example. You know, anybody who's at home saying, I should have done this earlier. Get over here,
Yeah.
right? Okay. Well, thanks so much for coming
Thank
in and
you so
sharing your
much.
story, and thank you so much for
Thanks
what you
for
do.
having me.
Nice to see you again. We appreciate it. Still to